A 79-year-old man comes for his scheduled 6-month visit. 3 years ago, he had a pacemaker implanted for a complete heart block, which resulted in a syncopal episode. He tells us that he feels poorly for the last 2 weeks following a dental procedure to remove several badly infected teeth. He says specifically he feels tired, sweaty, loss of appetite, and he's had recently several shaking chills. Blood pressure, a little elevated, but not bad for a man his age. Heart rate slightly elevated. Temperature definitely elevated. Normal would be 37. And he has signs of an infection. His complete blood count shows that his white cell count is 14,000 with 85% polymorphonuclear cells. Normal should be less than 10,000 with about 60 to 70% polys. So this is clearly there's an infection somewhere. So again, the critical factors, he's had third-degree heart block, he was appropriately treated with a pacemaker, and there's a history of a recent infectious process where he had badly infected teeth removed, and of course he has symptoms that suggest a febrile syndrome, probably an infection, and his blood pressure is a little bit elevated, but that's not so worrisome. This is much more worrisome, his fever. And again, of course, the white count with the polys tells us that there's an active infectious process. Here's his pre-pacemaker EKG, which shows complete heart block. There's no relationship between the P waves and the QRSs. You should take a moment just to look at it to notice that there's not a P in front of each QRS. And of course, the heart rate is markedly slow. There's a wide QRS because that's the ventricular pacemaker that takes over. And again, as mentioned, no regular relationship between P waves and QRSs. And the diagnosis was appropriate, third-degree AV block. And of course, he had a pacemaker implanted. This is a little diagram showing you a DDD pacemaker. That is, it is paces and senses in both the atrium and the ventricle, and it is inhibited if the heart rate itself is adequate. Here's a chest x-ray from a patient with a single lead VVI pacemaker. That is, it senses and paces only in the right ventricle, not in the right atrium. And you can see very easily on this chest x-ray the pacemaker box implanted. Here we see again his third-degree heart block. He gets some blood cultures. They grow Staph aureus. We do an echocardiogram that shows possible vegetation on the pacemaker wire. So what do? We have to remove both the wire and the pacemaker. The patient gets a course of intravenous vancomycin for a long time. He gets a permanent pacemaker implantation, and then next time he goes to the dentist, he needs prophylactic oral antibiotics. Now, what happens when we take out the pacer wire? Well, he's going to go back to third-degree heart block, so very often we have to implant a temporary pacemaker once we've given a few days of intravenous vancomycin.